opportunity to talk to you about the SHIIP program, which is the program that I work with. This is the second of a series of these cross-training sessions so we all can learn more about what each other does. And quite frankly, I'm glad about that. I've been here in Raleigh for 5 years, and I know a lot of you, but I really don't know what you do. So thank you for attending and learning about what we do at SHIIP. And I look forward to hearing your sessions and learn about what you do with the Department of Insurance. It was thought that maybe because some of you may have come in and thought the controller's office was going to do today. I am not the controller. I want to tell you that. I cannot add 2 and 2 and get 4. So this is about SHIIP. And it was decided that since open enrollment for Medicare is going on at this time, it might be good for you to hear from me about the SHIIP program. So I welcome this opportunity, and we all know each other, so it's going to be a little informal. So if you have a question along the way, raise your hand if you like, and I'll take the question, I'll try to answer it, and we'll keep moving. There will be time at the end to answer questions, so there'll be some time that you can answer any question that you have. All right, so SHIIP. What is SHIIP? Who are we and what do we do? So SHIIP is an acronym for the Seniors Health Insurance Information Program. As you probably don't know, but I'm going to tell you, Medicare was started in 1965 by then President Lyndon Johnson. And the SHIIP program in North Carolina was started in 1986. The Department of Insurance, being the leaders that they are in state government, decided that Medicare was complicated. And people, the citizens of North Carolina, needed to know a little more about what their choices were. So this department started the SHIIP program. In the early days, there were only about 3 people. And they were the real pioneers and the real workers in this program because they worked all day going out across the state, setting up coordinating sites, setting up places in the communities for people to learn about Medicare. And then they came back to Raleigh and did their work at night. In 1992, the federal government thought, well, you know what, SHIIPs are a pretty good idea. And so Congress funded SHIIPs for every state. So now every state across the nation has a SHIIP program. Congressman Price from right here in the Raleigh-Durham area was instrumental in writing the initial legislation. And he used the North Carolina model. And a lot of states use the North Carolina model when they set up their SHIIP programs. So I'm very proud of our program, not because of anything I've done, but because of what the people before me did and what a good program it is. We receive about 60% of our funding from the federal government, and the other 40% comes from the state. So who are we? Well, we're part of the CAG division, Consumer Assistance Group, along with Smart NC, who helps people with insurance issues that are under 65, and Consumer Services Group that helps people with property and casualty, life insurance issues, and those type things. So we're part of CAG, and we're the SHIIP program. We have 27 staff, and we have a call center with 13 people, and they're very, very good. They accept calls from 8 to 5, Monday through Friday. There's probably not very many questions about Medicare that they cannot answer. There's an occasional 1 or 2. During this time of year of open enrollment, which I'm going to talk about a little later, I'm on the phones helping out because, as you can imagine, we get a lot more calls than we normally do during a normal month. In fact, a normal month for us is about 3,000 to 3,500 calls. This time of year, our call volume goes from 6,000 to even 7,000 calls. Kathy, our senior deputy, has worked with us to cross-train some other staff from CSD, from Smart NC, so they help us out on the phones, and we're very grateful for that. So how are we set up? Well, as I said, we have a call center with 13, and we have a coordinating site in every county across North Carolina. And our coordinating site is part of our federal grant. We give them a small part of the money to be a voice for us in their counties. So we have a coordinator, and then the rest of the program is manned by volunteers. In fact, that's how this program was really set up, was to be a volunteer organization. So we have 5 regional managers that live in different parts of the state. And they go around to these coordinating sites several times a quarter, and they help train the volunteers, they help recruit volunteers, and they work with the coordinator to keep them up to date on Medicare. As you can imagine, Medicare being a federal program, it changes all the time. There's always new things happening and new things changing. And the regional manager's job is to make sure that our volunteers are trained and know all these changes so they can do the same thing in their counties that we do here in Raleigh. Our volunteer network, we have 967 volunteers across the state. And as you can imagine, every year we lose a couple of hundred and we gain a couple of hundred. Most of our volunteers are going to be like you. They're going to be people that have worked all their lives, and then when they retire, they don't want to sit on the sofa and watch TV all day. They want to give back to their community because that's what you've been used to doing. You give back all the time. If you didn't want to do that, you would not be in this job with the Department of Insurance. You want to help people, and so you're going to want to give back, and that's what our volunteers do. So they train. Medicare, as I said, is complicated. They have to take an online training course that I've taken. It is not easy. And then they have to sit with a mentor and learn about Medicare, learn how to answer phone calls, how to talk to people face to face, and then and only then will we let them be a volunteer. Now they also have to attend quarterly training to make sure that they're up to date on all the changes in Medicare. Another division that we have that I don't have up here is our S&P, which stands for Senior Medicare Patrol. We have 2 people and a part-time person that works with the Senior Medicare Patrol. Senior Medicare Patrol gets a small grant, and it's used to go out and educate people about fraud. As you can imagine, an organization with the dollars that's paid out like Medicare, fraud is rampant. It is rampant. And so the federal government, Centers for Medicare and Medicaid Services, said, why don't we let the SHIIPs go out and talk to people about fraud? When you get your summary notice, like your explanation of benefits that you get when you go to the doctor, we ask them to look at that. Are the charges right? Are the charges that you didn't have done? And if so, you can call us, our S&P group, and we can help you file a complaint without using your name. So we have helped people save millions, or helped Medicare save over millions of dollars in just in Medicare fraud. So what is it exactly that we do? Well, we assist Medicare recipients and those with disabilities. Medicare is health insurance for people that are over 65 and people that have been deemed disabled by Social Security for 2 years. And then you can sign up for Medicare. And we help them understand Medicare. Medicare is confusing. It's complicated. You got Medicare A, you got Medicare B, you got Medicare C, which is a Medicare Advantage plan, and then you got Medicare D, and also a Medicare supplement. Well, how does that work with my employer group plan if I have a retiree health group plan? How does all that work? And that's what we help people do. We help inform them and educate them so they can make good decisions about their health care. We assist a lot of state retirees. We get a lot of calls from them. The state health plan has a call center, but it's very small. And we get a lot of calls from state employees about, well, I'm retiring now. How does that work? Am I still on the state health plan? Am I on Medicare? Is Medicare primary? Is the state health plan primary? How does all that work? Part B, I'm on Part B. Do I need to sign up for Part B, or am I just on the state health plan? So we help them understand all these questions and make good decisions about what they should do about their retiree group health plan. The biggest thing we do is this time of year is open enrollment. Open enrollment starts on October 15th and runs through December 7th. In 1996, the Part D drug plan started. I was in Dallas a couple of years ago and went to George W. Bush's presidential library. and I came across the booth that they had set up. And George Bush was the president when the Part D drug plan started. And I thought it was really interesting. He had a quote that he said, Medicare will pay for a kidney transplant, but it will not pay for the drugs that might have prevented that kidney transplant. So the Part D drug plans came into effect in 1996. And that made our volume of calls go way up. And this time of year, you can look at your drug plan and you can decide if the plan you're on is right or whether you need to change or not. And I'll talk a little more about that when I get into the different parts of Medicare. We also assist with LIS applications. What LIS stands for Limited Income Subsidy. There's also a sister program called Medicare Savings Program. And what that is for people that are between 100 and 138% of the federal poverty level. These programs will help them pay for their co-pays, their premium on a Part D drug plan if they have a premium, and it also will help them pay their Part B premium or any part of it. It depends on where your income is in those levels. Now last year, I'm very proud to say that the SHIIP program helped North Carolinians save over $44.3 million. $44.3 million, and I'm very proud of that, of what our staff and our volunteers do. And you say, how in the world did you save people $44.3 million? Well, I'll give you an example. Medicare requires, on the Part D drug plans, Medicare requires the drug plans to cover drugs within a class. However, it does not require a plan to cover every drug. So if you're taking something for high blood pressure, and you went to the doctor and your doctor says, you got high blood pressure, I'm going to write you a prescription medication. So he writes you the first one, and it makes you dizzy. So you go back and say, that's not working, we need to do something else. He says, okay, I'll write you a different one. And he writes you another one, and that makes you hungry. You want to eat everything in the house. And you say, this is not working, I can't wear any of my clothes. And so, okay, let's try this one. So he writes you another one, and that works for you. You don't have any side effects. It controls your blood pressure, and everything is great until you go to the pharmacy, and you're on a Part D drug plan through Medicare, and you gave him the prescription. He says, oh, I'm sorry, the plan you're on doesn't cover that drug. You'll have to pay for that out of pocket. And so every year during open enrollment, which is October 15th through December 7th, anybody on Medicare should call us or go to one of our coordinating sites and look at your drug plan to make sure it covers the drugs that you're taking. I'll give you a couple of really good examples. This one happened just about a week ago. I was on the phone. Everybody was busy. I get on the phone. I'm the last one on the phone because I know the least. So when everybody else is busy, they say, Dan, you need to get on the phone. So I said, okay. Anyway, I had this very astute 81-year-old lady call me, and she said, my husband has been prescribed a new heart medication. I always think it's interesting that the wives always call for the husbands. I don't think the husbands know enough to ask the right questions. So anyway, so the lady said he's been prescribed a new medication, and I just want to make sure it's on the drug plan that we're on. Well, I don't do, and we don't do anything that you couldn't do for yourself. We go to Medicare.gov, which is a Medicare website. We put in the information, we put in the drugs you're taking, it'll show us the plan you're on, and it will list the options for you. The lady was absolutely right. The new drug that her husband had been prescribed was not covered by the drug plan she was on. Now, if she had not thought about this and did nothing, then in January, when they went to the pharmacy to get that medication or that prescription filled, she would have been surprised when the pharmacist said, okay, you owe us $80 or $90, or actually it'd been more than that, for that prescription medication. I said, but ma'am, you're absolutely right. It is not covered by the plan, but here's a plan that is. And I gave her all the information about that. She said, can you switch me? I said, I certainly can. And we can switch them right over the phone. When we put them in one plan, it kicks them out of the other plan. If she had stayed in the plan they were in, her husband, it would have cost them $15,000 next year out-of-pocket cost for all the medications he was on. By switching her to a different plan that covered the medication that he was taking, this new heart medication, it was going to be about $3,500 out of pocket for the year. That's still a lot of money for those of us that don't take medications, but it was a lot better than the $15,000 that they would have had to pay if she had not been wise enough and smart enough to look into this during the open enrollment period. So when you have us doing this all over the state, and we did 105,000 consumers last year, that's the number of consumers that had contacted us and our coordinating sites about looking at all the facets of Medicare. That's where the $44 million comes into play. Okay. So how we help, and I've already talked about a lot of this, we educate consumers to make sure they have the information they need to make informed decisions for themselves. We do not make any choices for people. That is one thing we're told not to do. And sometimes that's very hard because you'll get a sweet little lady on the phone and you'll give her the options and she'll say, what should I do? And that's not our job. That's not our role. Our job is to give them the information. And we normally say things like, well, if you change to this plan, you could save money. You could save this amount of money, or you could do this, or you could do that. And then we let them make the decision for themselves. As I've mentioned earlier, we saved $44.3 million for consumers last year. The year before, we saved $53.1 million. I don't know, I don't ever have the time, but I'd love to go back and see what we've saved consumers over the life of the SHIIP program. I think it would be staggering. And as I said earlier, we educate and help people save money on the LIS programs. Now here in North Carolina, there are about 50 Medicare supplement plans. There are about 30 different drug plans. And there's about 15 to 17 Medicare Advantage plans. And so that's a lot of information. That's a lot of information for anybody to have to consume and understand. I know all you guys are mostly young and you're not anywhere close to Medicare age yet, but I am, and believe me, when you get close to Medicare age, you will get bombarded with mail. All of these 50 supplement plans and all of these Medicare Advantage plans are sending you all this advertising in the mail. Take our plan, take our plan, take our plan. Well, buried underneath all of that stuff is something from Medicare. And most people don't even see it because they throw this out, throw this out, throw this out, and they throw the Medicare stuff out. So then the things that they needed to read, they don't read because it got buried in all the stack of mail that they get. So they call us, and that's good. I tell people that we are a different type of call center. You know, if you buy a washing machine, it doesn't work, call center doesn't want to hear from you because that means you got a problem. But we want you to call us because one of the things we're graded on, and graded is probably not the right word, but one of the things that Medicare wants to know from us, but with the grant dollars they give us, is how many consumers did you talk with and how much money did you save those? So we want people to call us. We want them to call us and ask their questions. We don't sell refrigerators, so our call center is not about that. Okay, so I'm going to hit the basics. I don't want your eyes to glaze over. I don't want you to go to sleep. But I do want you to understand basically the parts of Medicare. I know it's really funny, when I took this job, I said, well, I'm around my friends or I go to a social event and I start talking about Medicare, people's eyes are going to glaze over. They're going to say, oh my God, is this boring or what? But I'm really surprised. Most people are really interested because either they have family members that are on Medicare or close to Medicare, or they themselves are getting close to Medicare. So I'm going to run through the parts real quick. As I said earlier, if you got a question, raise your hand. Be glad to answer it for you. So what are the parts of Medicare? Well, there's Medicare Part A. Now remember, when you turn 65, this is your health insurance. You need to sign up for this. And I'll talk a little more about some people that don't sign up for it. State employees are a big class of that sometimes. But Medicare Part A, if you've worked 40 quarter hours or 10 years, then your Medicare Part A is premium free. And if you go to the hospital, you will have a $1,316 deductible for days 1 through 5. Now, if you're so unlucky in today's world, nobody hardly stays in the hospital more than 5 days, but if you're so unlucky that you're in the hospital for more than 5 days, from day 6 through day 60, Medicare pays the whole hospital bill. So that's that one deductible. Now, a caveat that you need to remember about this when you're talking to your family. This is not an annual deductible. This is about the only deductible that I know of that is not annual. So let me give you an example. If you went in the hospital in January with pneumonia and you were there 3 days, you would have paid the $1,316. You came out, you got well, you went home. In June, you fell and you broke your hip. You got to go back in the hospital for hip surgery. Then you will pay the $1,316 again. It is not an annual deductible. Okay, but other than that, Medicare pays pretty good. Okay, the Part B is your doctor's insurance. It pays for services, it pays for procedures like a CAT scan or an MRI, or you go to your doctor. It's basically an 80-20 plan. It has a $184 deductible that you pay the first time. Now that is an annual deductible, and it is basically an 80-20 plan. Now, Medicare Part B has a premium. The premium for 2018 is $134. So we get calls all the time. I'm a state retiree. Why do I need to take Part B? I got the group health plan through the state retiree plan. And because the answer will never change, it's always the same, just about every group health plan is going to pay as if you have Medicare Part B. We've had calls when somebody call us up and say, yeah, I got a bill from the surgeon. It was $10,000, and the state health plan paid $400 of that. Who's paying the rest of it? And our first question is, well, did you sign up for Part B? No, I'm on the state health plan. Well, if you do not sign up for Part B, the state health plan is going to assume that you did. And it's not going to pay what Part B would have paid. And that is the case in just about every health insurance plan that I have seen. There's a couple of little government plans that might not, but just remember this, your family, I don't care what, the group health plan, you need to sign up for Part B. Back in 1965 when Part B came out, I'll give anybody free lunch who can tell me, I already got some. I give anybody free lunch who can tell me what the premium for Part B was in 1965. I'm glad. I don't have any money to buy your lunch. It was $3. And now, going into the 2018, it's $134. And people say, well, where does that come from? Who comes up with that figure? Well, I think it's kind of interesting. The Medicare Trust Fund pays 75% of Part B claims. So there's a law in Congress that states that the Part B premium must cover 25% of the Part B claims. So as you can imagine, with health care costs going up, people living longer, using more services, that premium has gone up from the $3 to $134 and probably will continue to go up. But if you don't remember anything else I say today, remember that you must have Part B and you must pay that premium. So what happens if you don't? Well, you're going to be penalized because this is health insurance. It's not rocket science. We're all in the Department of Insurance. The insurance companies need 65, 66, 67-year-old healthy people paying into the fund so the 85, 88, and 90-year-olds that are filing a lot of claims can have money to pay their claims. It's the way any insurance works, auto, homeowners, all of them. A lot of people pay in so some people can file claims. So if you don't take the Part B premium when you're 65 and Medicare eligible, then you will be penalized roughly 10% a year for as long as you're on Medicare. And it never, ever goes away. I've not heard of anybody who ever got out of paying the penalty. So that's Part B. Then there's Part C, Medicare Advantage. It's also called Medicare Advantage Plan. So Medicare Advantage Plan, what's that all about? Well, a lot of companies, and this is private insurance, a lot of companies went to Medicare and said, you know, if you'll pay us what you put into trust fund every month for Medicare recipients, we'll be their health insurance. And I've been told it's about $700 a month. I don't know if that's true or not. With everybody on Medicare, that's what's put in monthly for them in the trust fund. So Medicare said, well, you know what, we'll do that as long as you follow Medicare guidelines. So Medicare Advantage plans came into being. And they've been popular, and they're growing. About 30% of people now on Medicare are on an Advantage plan. So what are the advantages of an Advantage plan? Well, in a lot of cases, your copays are less. Like I said about Medicare, remember Part B, it's an 80-20 plan. It's got a $184 deductible. If you're on a Medicare Advantage plan, they work more like the state health plan works. You go to the doctor, it's a $10 copay. If you go to a specialist, it's a $40 or $50 copay. Urgent care is usually less. And another thing people like about a Medicare Advantage plan is it includes your prescription drug coverage. So it's all in a neat little package. It covers the drugs, your hospital, and your doctor coverage. The copays I have seen, if you go to the hospital, they're annual, but they sometimes run a little more than original Medicare. But a lot of people like that. They like it all being in a little neat package. So the next question will be, well, then what are the disadvantages of a Medicare Advantage plan? Well, Medicare Advantage plans are county and state specific. So remember, these are private insurance plans. So they may look down where I live in the eastern part of the state, and if the obesity is rampant and diabetes and high blood pressure, they may decide not to sell their plans in those areas. Remember, these are insurance companies. We deal with them all the time. They're in it for the money. Not completely, but they're in it to make a profit. So a lot of counties, there are not a lot of plans available. I live in Lenore County. There's one Medicare Advantage plan offered. So that's one disadvantage. You could be right across the county line, and we get this call. My neighbor's got a Medicare Advantage plan. I think it's great. I want to be on it. But I live 100 yards away from him, and I live in County X, and he lives in County Z. How can they do that? Well, they can do that. They can choose where they want to sell their plans. So plans are, Medicare Advantage plans are county and state specific. Another thing is if you're out of this county, or out of the state, and you're in Georgia visiting your family, and you get sick, your daughter-in-law cooks something and it makes you sick, and you go to the doctor, the doctor may not take the Medicare Advantage plan because he's out of network. Now, every doctor has to take Medicare Advantage if it's an emergency. But what you may think is an emergency and what the doctor or Medicare thinks is an emergency may be a different thing. So lastly, I'll talk just briefly, and I'll leave some time for questions. I'm running over a little bit here. The Part D prescription drug, that's what we spend the most of our time doing. You can change Part D drug plans every year, just like you can change a Medicare Advantage plan every year. So during the open enrollment period, that's when you need to look at that. I've already talked about the Part D prescription drug plans, but if you have family that are on Part D drug plans, they should look at those plans because they could save money by switching to another plan. Sometimes it's $200 or $300 a year. Sometimes it's several $1,000s a year. And so it's always a good idea to look at your Part D drug plan. And the last thing I'm going to do briefly is there's Medicare supplement plans. And Medicare supplement plans is a private insurance plan, and people who stay on Medicare Part A and Part B can buy a Medicare supplement plan, and that pays basically, depending on what plan they buy, any part of Medicare does not pay, the Medicare supplement will pay. A brief story there. My brother's wife had hip replacement surgery 2 summers ago at Duke. The bill was $55,000 between Medicare and the Medicare supplement plan they had. They didn't pay a dime. So it's very good coverage, but you have to pay an additional premium for the Medicare supplement plan. All righty. I gave you a lot of information in a very short time, so I'm going to open it to questions, and I will try to answer any question that you have. Yes?
I have 2 questions. First question is, I believe you quoted $134 for the Part B medical. Is that a monthly or annual premium?
Okay, the question is, and thank you for the question, is the $134 premium for Part B, is that monthly or is that annual? I'm afraid I have to tell you it's monthly. It's $134 a month. Thank you for clarifying that. And your second question?
I'm interested in how you calculate savings for a particular consumer. Let's say person X. So if person X calls you or walks into a volunteer center or here in Raleigh and they have some questions. Let's just say for the sake of argument that they're on some plan, perhaps a prescription drug plan, and they're paying X amount for this particular plan. And I understand your job, as you stated it, is to show them various options. And let's just say that currently they're paying $1,000 under this plan. Or I'm sorry, let me go back to your example. I apologize. $15,000.
Okay.
But you show them a couple options, one of which is bringing their $15,000 a year down to $3,500 per year, and maybe a couple other options. Maybe there's another option at $5,000 per year, there's another option at $7,500 per year. Because my understanding of what you said is that you're showing the person options. You don't know which option, I assume, they ultimately choose to select. So how do you calculate the savings on person X?
Another good question. Another good question. So the question is, if someone came out, like the example I used, the gentleman was taking the heart medication, if he'd stayed on the plan, it was going to be $15,000. I told the wife that we could enroll her in another plan. It would be $3,500. The question is, how do you know that they calculate? How do you know you saved them that money? And the answer is because we enrolled them in the plan. We don't force them. We say you could save and have a $3,500 out-of-pocket cost by switching to this plan. And then we say, if you would like for us to, only if you would like for us to, we can enroll you in that plan. We can enroll anyone in a Part D drug plan. We can enroll anyone in a Medicare Advantage plan. Good question. And if we put you in a Part D drug plan, it will automatically kick you out of the drug plan you're in starting in January. So remember, open enrollment is October 15th through December 7th, but the plan will take effect on January 1. So if they ask us to enroll them, we will enroll them, and the plan will start in January, and we calculate that cost savings. That's a good question, because if we don't enroll them, we do not capture the cost savings. So we probably save more money than what I have told you, but we only capture it if we enroll them, because we have to justify this. When the commissioner is out giving speeches and he talks about SHIIP saving $44 million, we need to be able to back that up. And so we do that. Right. So it's a good question.
Right.
Thank you.
That was exactly what I was getting at. Your true savings is really way bigger.
It very well could be. It very well could be. Thank you. Yes, ma'am.
Do you have to re-enroll every year, or if you don't re-enroll, say you're in the hospital, do you stay on the same plan you were on the year before?
Good question. So the question is, do you have to re-enroll every year? And the answer is basically no. If you're on Medicare Part A and B, as long as you make the premium payment, you're going to stay enrolled in that. Now, if you want to look at other options, then during the open enrollment period for Medicare Advantage plans and Part D plans, you can call us or go to a coordinating site or do it yourself on the computer, and then you can choose another plan. But if you do not choose another plan, you will stay on the plan that you're on, or stay in the plan that you're on. Good question. Thank you. Yes, sir, Joe.
How does the state plan fit in, retire the state?
Another excellent question. I need to take you people on the road with me. All right, another great question. So how does the state health plan work? Okay, and I probably should have talked about that since I threw the carrot out there. So when you retire and you reach 65, you're going to go on Medicare. You need to sign up for Medicare Part A and Medicare Part B. You got to pay the premium, the $134. Medicare becomes your primary source of health care. The state health plan will be your secondary provider. Now, it got more complicated with the state. You have two choices now. You can stay on the 70-30 plan. They do not offer the 80-20 anymore for retirees. You can be on the 70-30 plan, or you can sign up for the United Healthcare Medicare Advantage plan. And a lot of big corporations, the state didn't dream this up. A lot of big corporations are doing that because, as you can imagine, big corporations like the state of North Carolina, Goodyear Tire, IBM, those folks, they self-insure. They self-insure. I hear people all the time say, oh, I'm on Blue Cross Blue Shield. No, you're not. Not if you're on the state health plan. You're with the state health plan. We self-insure. Blue Cross Blue Shield is the administrator. So these companies say, well, you know what? We don't know what our liability is when we self-insure. You know, if we had 100 people have to have heart transplants next year, that's a huge liability. So a lot of companies are going to Medicare Advantage plans. They pay the premium of the Advantage plan, and then the risk is then taken by the Advantage plan. Now, I have to tell you, I'll be very candid with you. I'm not trying not to tell you anything wrong. I was not a fan of Medicare Advantage plans several years ago, but they've gotten better. And I think the state Medicare Advantage plan is a pretty good plan. It's a hybrid. It's better than what someone could buy off the street. And a lot of retirees are going to the Medicare Advantage plan. My wife is a retired high school guidance counselor. She is on the Medicare Advantage plan. So you got to sign up for Part B. You got to pay that premium, and then you can elect a plan. Now, people say, well, I'm on a Medicare Advantage plan. That's not Medicare. And that's right, it's not. If you're on a Medicare Advantage plan, you are no longer on Medicare. You are on private insurance. However, you still have to pay the $134 premium, because when this system was designed, it was designed with that fact that the $134 premium for the Part B was going to be paid. But the Medicare Advantage plan, it works well for the state. Another thing, you can try it. If you're on the 70-30 plan, you're a retiree, you've got family members that are retired, and they're on the 70-30 plan, the neighbor says, oh, I'm on the Advantage plan, it's great, I love it. Then you can sign up for the Advantage plan during open enrollment, during the state open enrollment period. And then you'll have that for the year. If during the year you don't like it, then the next year in open enrollment, you can switch back to the 70-30 plan. Good question. Yes, ma'am.
Medicare Advantage, you still have to have the prescription drug D plan?
No,
Okay.
no. So remember, good question. This is a lot of stuff. It's a lot of confusing. First thing I want to say is, if you ever have any questions, call us. We're on the 3rd floor. Come down to see us. We will help you. We count you as a client contact. So when I send at the end of the year client contacts, I don't have to say how many people I work with. I just say how many client contacts. So, good question. Okay, wait, I got to answer. So the Medicare Advantage plan is all-inclusive. It covers your Medicare A, your B, and your drug coverage. So only if you're on Medicare A and B do you have to buy a separate drug plan. Good question. Yes, ma'am. Yes, sir. I'm sorry.
These costs, they vary every year, so you really need to look at your plan every year to see if you've got the best cost fit for what you want and the best coverage. And then you got a matrix on your website that people could go in and actually pick, see all the different plans for that year and compare. Do you still have that?
We have all the Medicare supplement plans on our website. Good question. We have Medicare supplement plans on our website. It has kind of an average cost because Medicare supplement plans can vary from county to county. So those are average costs. The Medicare Advantage plans, we don't have that on our website, I don't believe. You can go to medicare.gov and that will list the plans for the state of North Carolina, or you can call us. Any other questions? I can stay here all day. Yes, sir.
Medicare covers spouses and dependents?
I'm sorry, Medicare cover dependents?
Yes.
Very good question. Does Medicare cover dependents? If you're 65 and your wife is 60, or if you're 65 and your wife is 30, that's what I like to think about. So does it cover dependents? And the answer is no, it does not. So, but that brings up another good point. If you are on a retiree group health plan and you turn 65, then you should go on Medicare, but your spouse could stay on the employer group plan in most cases. Not all cases, but most cases. Good question.
I have a question.
Yes, ma'am.
I have a question. If you're actively working at age 65, do you still have to enroll in Medicare?
Great question. Great question. So the question is, if you're 65 and you're still working, do you need to enroll in Medicare? Well, it's kind of a yes-no. I would say yes, you would want to enroll in Part A because it's free. If you've worked 40 quarter hours, 10 years, it's free. But you could defer, Garland, to Part B and not pay the $134 premium. Now, the only caveat to that is you have to be enrolled in a plan that has credible coverage. And credible coverage basically means the plan is equivalent to what you would have if you were on Medicare. So I use myself as an example. I'm 65, actually I'm 66. I know I don't look it, but I'm 66. And so I'm still working. So I deferred Part B, I signed up for Part A, and I deferred Part B until which time I retire, and then I will take Part B. Good question, excellent question. Any other questions? Well, I want to thank you. Thank you. Yes.
I just wanted to thank you because unfortunately Mike, right next to me, I was just saying to him, Mike, this is a compliment.
Thank you. I hope if he's an expert, I hope I didn't say anything wrong. Thank you so much for taking some time out of your busy day.